Big Money Bound TV, RRT Posse, YouTube. If you're new to the channel, please like, subscribe, and turn on post notifications. I release scheduled videos every Monday, 12 o'clock a.m. Eastern Time. But I also release some unscheduled videos throughout the week. Now, if you're returning, welcome back. I appreciate all the support. Thank you. What we represent, man?
Big Money Bound.
Say, let her know, man.
Big Money Bound.
You got the kid, man. You got the kid, man. This is my car talk from probably like a week off from car talks. Cause I said I've been off for like 4 days in a row. I made the mistake of believing that I was gonna go to my part-time job Thursday and Friday. So I didn't pick up at my job on Wednesday. They wanted me there on Wednesday, but I was gonna be out of work Sunday, Monday, Tuesday, Wednesday, Thursday, Friday. So out of work 7 days in a row. But I'm like, nah, man, you know what? I'm gonna chill. I'm gonna go home, have a little downtime, get my mind right, do a little reading, do my study guides. Then I'm gonna just go to work and get that fitted. Well, I didn't work that Wednesday at my full-time job. My per diem job canceled me on Thursday. Then on Friday, it was payday. And let's say I ain't feel like going to work though. I had the money in my pocket. You know how it is when you feel me? You get the money in your pocket and you just kinda, So I called my per diem job like, hey dog, yeah, I ain't gonna be able to make it, man. I ain't in the mood, dog. And it's like, normally I don't really do that, but I don't know, as of lately, I'm just thinking of Fetty so differently, man. Like, seeing that I can get it other ways with just having fun and being me, I don't really feel like going to hit that nail in the head like that. But so I called off from over there. They said they was gonna cancel me again anyway, so it didn't make no difference. So I've been off for a little minute, man. I ain't really did no car talks. But last night I was back at work. I was back at my full-time job. They had me covering the long-term vented patients. That was cool because it wasn't really it wasn't too many vents. I think I had 3 vents. But then I had to go to the other side of the hospital and get breathing treatment. So that's what made the workload kind of steady. Without that, it would have been easy. So I had a steady night. You know, I had a few interactions with the nurses that I had to go give treatments on the floor to. It was a nurse was telling me she got a patient on 100% oxygen. Can I help her? Patient on 100% oxygen. And she was wondering, the patient want to know, can they come off? How can I help with that? I'm like, yeah, the patient can come off. That's no problem. They on another breather, they sat 100%. You got to lower the oxygen. You got to go down to a venturi max 50%. She's like, yeah, well, the patient wants to eat. I'm like, okay, that's no problem. Let's go nasal cannula, 4 liters. 4 liters is how many? 4 liters is how much FiO2. You feel me? 4 liters is how much FiO2. 4 times 4, that's 16, plus 20, that's 36. I gave it again, you feel me? So that's 36%. You put them on nasal cannula. Then you watch the patient. If the sats remain above 92, 93, you good. Now if they dip down, you gotta go back to the normal breather. That's it. That's how we gonna do that. Oh, okay, that's a good idea. We did that. Everything was cool. I leave that floor. I'm done with all them treatments on that floor. Everybody good. I leave. What do you know? Dog called me back. Yeah, patient with the BiPAP saying that they can't breathe and they screaming. The worst patient to have, man, is somebody that's unruly, that's on non-invasive ventilation, that's on BiPAP, CPAP, and they not cooperating. They not being receptive to the treatment that they supposed to be taking, bro. They need BiPAP. They don't want to use the BiPAP. Bro, this is helping keep you alive. This is serious, man. I go in here, dog screaming out, I can't breathe. Dog got the BiPAP mask disconnected from the mask. The port is off the mask, so it's just a mask on the patient's face and no port connected. Bro, you ain't gonna be able to breathe if you're taking the BiPAP off. And if you take the BiPAP off and you need it, something bad can happen. Now, I ain't saying what can happen. I'm just saying something bad can happen. Down in the comments, can you let me know what can happen? If a patient needs a BiPAP and they're taking off the BiPAP, what could happen? They need help ventilating, and now they're not ventilating, what can happen? Please let me know. Patient saying, I didn't take it off, bro. It's in your hand, dog. But it's in your hand. What you mean? It's in your hand, bro. You gotta deal with that kind of stuff. Sorry, man. Excuse me. I just did 12 hours. You gotta deal with that kind of stuff, man. Like, you hurting yourself, dog. Literally, you hurting yourself. And about that patient that was on the non-rebreather mask that we had put down to the nasal cannula, not a nurse want to call me. Yeah, that patient, I see they had BiPAP ordered in the afternoon. They had BiPAP ordered 2 o'clock afternoon. It's 2 o'clock a.m. Yeah, can you come on and put that patient on BiPAP? Like, bro, why would I do that? Because they have it ordered, like, but I was just in the patient's doing fine. Well, now she's having, it's like she's using like some, she's having like some, they want to throw respiratory care terms at you. She's having some kind of labored breathing and accessory muscle breathing. I hear how you talking, and the question that you asking me before about how to like wean down the FiO2 from non-rebreather mask, you kind of like nervous and unsure, so you just want to have the patient put on like some support so you don't got to worry about it. I hear it in the nurse's voice. Yeah, it's like, so I'm like, okay, what's the patient's SAT? Because the SAT is 100. Oh yeah, they're SATing fine, but it's just that accessory muscle breathing. The accessory muscle breathing is kind of like making me a little bit uneasy. Yeah, I'll be up there, no problem. I'll be up there with a BiPAP. Now I know a patient don't need the BiPAP. I know, I was just up there, but I'm gonna just take a BiPAP up there, go in the patient room. Patient in bed, sleep, man, 100%. Like, bro, why are you messing with me, man? But see, it's not that she messing with me, even though she is. The nurse isn't messing with me, even though the nurse is messing with me. But it's like, they just feel comfortable getting as much respiratory therapy treatment for their patient as they can possibly get. But I'm going to let you know that, hey, dog, I ain't going to be running back and forth. I ain't nothing wrong with no patient. So I'm like, hey, man, I got the BiPAP in the room. It's on standby. Right now, the patient is doing great. But if something happens and they need it, I will be back to put it on. But right now, it's not needed. Oh, thank you very much. Thank you. Hey, man, you welcome, dog. Speaking of, like, some things that's not needed, dog. Like, working amongst the hospital staff, dog. You know, you meet a lot of people, man. You meet and greet a lot of people. And if I meet and I greet you one day, and you a certain way, and I see you the next day, you a completely different skin tone, or just like appearance, I'm gonna be kind of like drawn back, like, bro, something is up, bro. Hey, man, moderation. I see you with no tattoos one day, and the next day you just fully tatted up. All I'm saying is, man, live your life, but just do it in moderation, bro. That's it. Nah, I come back on my next car talk, my muscles out to here. Y'all gonna say, damn, hey, are you okay? That's all I'm trying to get at, bro. I'm seeing people, I'm like, hey, dog. Hey. I asked the nurse. I seen somebody who was like, I don't want to say weird and strange, but hey, something wasn't right. So I asked the nurse, I'm like, hey, it's a nurse I don't know. So I'm like, hey, do you see anything like out of the ordinary on this floor? Like, is everything normal? Nurse like, yeah, everything's normal. I'm like, ain't nothing kind of strange? She's like, well, there is kind of one thing, but I don't know if that's what you're getting at. Hey, I think that is what I'm getting at. What is it? Me and dog was on the same page. Dog was like, yeah, man, I was taken back when I seen that too. All right, bro. There's a lot of weirdness going on, dog. BiPAP, man, I don't judge nobody, but I'm saying, like, it's just, if I see something, I can't hide my facial expression. My facial expression will let you know that, yeah, I seen something, dog. I'm gonna look at you. I'm gonna be like, oh, like, you gonna know, like, yeah, he seen something. Hey, man, I'm out of it, dog. I'm finna head home. I'm back at work tonight. Bro, I'm back tonight, dog. Like, I don't know, like, it's been like one of them weeks where like I'm feeling like, man, F this job, dog. But you know, it's ups and downs with it. It's ups and downs, bro. Y'all probably like, yeah, man, but respiratory therapy saved me. Yeah, it did, and I'm thankful for it saving me. But it's like my first year of respiratory therapy, my second year, my third year, it was all good. Feel me? I ain't never had no complaints. I ain't never feel like, man. But my fourth year, I wouldn't feel it every now and then. My fifth year, man, them people, man, them people. But that's how I go, thug. Y'all be easy though. But that sunroof back, man. Pull it back. Pull it back. Pull it back.